healing is a unique specialty. The field is as large as your imagination. It demands creativity, artistry, and in-depth appreciation of all the different medical disciplines and every facet of the patient's health that influences their healing potentials. I'm Dr. Babak Hajhosseini, a board-certified, double fellowship-trained wound healing specialist and the founder of Wound and Burn Centers of America. We are specialized in complex wound healing, burn injuries, hyperbaric oxygen therapy, scar treatment, limb preservation, laser therapy, and regenerative medicine. I founded Wound and Burn Centers of America because I realized how our healthcare system was failing this vulnerable patient population. The fact is that the science of wound healing is not systemically embedded into our traditional medical education, and wound healing services as a result are being rendered by providers of a variety of different training backgrounds. These individuals see wounds purely from lenses of their respective subspecialty, and they often lack comprehensive appreciation of these pathologies. We have changed that now. We are in fact the first provider of wound healing services in the nation, being led by a specialist with distinctive fellowship training in both major disciplines of the specialty, complex wounds as well as burn injuries. This is the level of expertise our patients deserve, nothing less.
I'm living a happy, healthy, and active life, and yet no one would know that prior to meeting Dr. Hajhosseini, I was on the verge of losing my leg. I had a very stubborn wound that simply would not heal. And when he met with me, he said, "We got this." And in fact, we did. He used cutting-edge therapies to finally heal the wound. There are not enough words to describe the gratitude I have for Dr. Hajhosseini. He gave me the courage and the determination to continue to fight on, and I'm the living proof of it.
Our core mission is to disseminate the science and art of wound healing in the United States and around the globe. We partner with leading global humanitarian organizations and academic institutions to fund and scale wound healing centers in resource-limited populations. We educate, train, and mentor local health professionals to make lasting changes and transform lives of those in greatest need. Plus, we run a teaching program, a fellowship training in wound healing, which gives us the crucial opportunity to nurture the next generation of top experts. Every few seconds, somewhere around the world, someone loses their limb because of a complex wound. The price the patients, their family, and the society pay is unfathomable. The cost of treatment, years of potential productivity lost due to disability, and psychosocial consequences of these rather sinister conditions are alarming. If we ever move the needle on any of these fronts, we can affect everything downstream. And perhaps one day we can look back and think we justified our privilege of existence.